Without a doubt, the question I get asked most on TikTok is how did I go about getting diagnosed with ADHD at 50? I didn't realise I'd got ADHD until I was 49, and I'll do another video on how I actually found out. And obviously my first port of call was the GP. What I'm going to talk about in this video is the referral, and the referral only. I'll do another video on the assessment and the diagnosis. So I went to the GP and she asked me a number of questions that the answers to were scored. So it's a standard questionnaire that they have and they use on anybody that is possibly presenting with ADHD. And you've got to reach a certain scoring criteria to qualify for a referral. Only a psychiatrist can diagnose ADHD in this country. So you've got to get the referral from your GP. I scored really highly. She says, yes, I think you probably do have ADHD, so we need to refer you. And I had three choices at this point. The first one was to go to my local mental health services. Now, the NHS mental health services have probably been underfunded more than any other department within the NHS. So the waiting list there was 4 years, and they were turning down a number of adult referrals. I'm not sure how they're allowed to do that because that's discrimination, but there you are, they're getting away with it at the moment. So my GP said, you know, that's one of your options. Another option is something called Right to Choose. Now, Right to Choose is across the NHS. It's not just for mental health. It's not just for ADHD. It's for any condition that you need a referral for. You have a right to choose. The NHS has a number of healthcare providers that it has approved. And if you want, you can get your diagnosis and treatment on the NHS via those providers. Okay, so it's all funded via the NHS. She told me about a website about Right to Choose, and I will put the website in the description for anyone that wants to have a look at it. And it was for an organisation called Psychiatry UK. She said, have a look at that on the website. There are some forms to fill out if you want me to refer you via Right to Choose. Go home, have a look at it and decide what you want to do. So off I went. I went home straight away, looked at the website, and I was happy with what I read. The wait list was about 6 months, although I did end up waiting a little bit longer than that, and obviously that's much better than 4 years. So I printed the forms out, filled them out and took them straight back up to the surgery, and that was my consent for them to refer me via Psychiatry UK. The other choice that I had was to go private. Now, there is nothing wrong with a private diagnosis, I have to say that. However, there have been some real difficulties for people who have pursued a private diagnosis, and I want you to be aware of this before you actually make any decisions. There was a BBC Panorama programme which really cast doubt on private diagnoses of ADHD, and some people who have had a private diagnosis have ended up with their diagnosis being rejected by their GP practice. Now, what this means is that anyone who's had their diagnosis rejected in this way cannot receive treatment for their ADHD on the NHS via their practice. So their practice is saying, we don't accept this as a diagnosis, we don't accept that you need treatment, and therefore we will not prescribe you any medication or therapy on the NHS. So if you want your medication or your therapy, you're going to have to pay for it privately. And I think some people have been paying upwards of, you know, £300 a week for medication after that, and then obviously they've paid for the private appointments and assessments as well. So it's something to bear in mind. Not all practices are doing this, and times are changing. Your practice may have a private provider that they're happy with. The only way to find out if this is something that could work for you is to speak to your practice manager before you actually part with any of your hard-earned money, because I'd hate to see you waste it, and I'd hate to see you really disappointed with the outcome. So speak to the practice manager and see how they would handle that. In the next video, I'm going to talk about the assessment and the forms that I had to fill in before the assessment. If you've got any questions, please do let me know and I'll do my best to answer them for you. Okay?